Assalamualaikum warahmatullahi wabarakatuh. My name is Fadatul Marhamah from class 2C, nursing student of Sultan Ageng Tirtayasa University. On this video, I will read the article about congestive heart failure or CHF.
Congestive heart failure or CHF is a chronic progressive condition that affects the pumping power of your heart muscle. While often referred to simply as heart failure, CHF specially refers to the stage in which fluids build up around the heart and causes it to pump inefficiently. You have four chambers. The upper half of your heart has two atria, and the lower half of your heart has two ventricles. The ventricles pump blood to your body's organs and tissues, and the atria receive blood from your body as it circulates back from the rest of your body. CHF develops when your ventricles can pump enough blood volume to the body. Eventually, blood and other fluids can back up inside your lungs, abdomen, liver, and lower body. Left-sided CHF is the most common type of CHF. It occurs when your left ventricle doesn't properly pump blood out to your body. As the condition progresses, fluid can build up in your lungs, which makes breathing difficult. There are two kinds of left-sided heart failure. First, systolic heart failure occurs when the left ventricle fails to contract normally. This reduces the level of force available to push blood into circulation. Without this force, the heart can pump properly. Second, diastolic failure or diastolic dysfunction happens when the muscle in the left ventricle becomes stiff. Because it can no longer relax, the heart can't quite fill with blood between beats. Right-sided CHF occurs when the right ventricle has difficulty pumping blood to your lungs. Blood back up in your blood vessel, which causes fluid retention in your lower extremities, abdomen, and other vital organs. It's possible to have left-sided and right-sided CHF at the same time. Usually, the disease starts in the left side and then travels to the right when left untreated. Congestive heart failure stages. And this is the stage of congestive heart failure. Class 1. Main symptoms. You don't experience any symptoms during typical physical activity. Outlook. CHF at this stage can be managed through lifestyle changes, heart medication, and monitoring. Class 2. You're likely comfortable at rest, but normal physical activity may cause fatigue, palpitation, and shortness of breath. Outlook. CHF at this stage can be managed through lifestyle changes, heart medication, and careful monitoring. Class 3. You're likely comfortable at rest, but there's a noticeable limitation of physical activity. Even mild exercise may cause fatigue, palpitation, or shortness of breath. Treatment can be complicated. Talk with your doctor about what heart failure at this stage may mean for you. Class 4. You're likely unable to carry on any amount of physical activity without symptoms, which are present even at rest. There's no cure for CHF at this stage, but there are still quality of life and palliative care options. You'll want to discuss the potential benefits and risks of each with your doctor. CHF may result from other health conditions that directly affect your cardiovascular system. This is why it's important to get annual check-up to lower your risk for heart health problems, including high blood pressure or hypertension, coronary artery disease, and valve condition. Hypertension. When your blood pressure is higher than normal, it may lead to CHF. Hypertension has many different causes. Among them is narrowing of your arteries, which makes it harder for your blood to flow through them. Coronary artery disease. cholesterol and other types of fatty substances can block the coronary arteries, which are the small arteries that supply blood to the heart. This causes the arteries to become narrow. Narrower coronary arteries restrict your blood flow and can lead to damage in your arteries. Valve condition. Your heart valve regulates blood flow through your heart by opening and closing to let blood in and out the chambers. Valves that don't open and close correctly may force your ventricles to work harder to pump blood. This can be a result of a heart infection or defect. And other conditions. While heart-related diseases can lead to CHF, there are other seemingly unrelated conditions that may increase your risk too. These include diabetes, thyroiditis, and obesity. Severe infection and allergic reaction may also contribute to CHF. In the early stage of CHF, you look most likely won't notice any changes in your health. If your condition progresses, you'll experience gradual changes in your body. Chest pain that radiates through the upper body can also be a sign of heart attack. If you experience this or any other symptoms that may point to a severe heart condition, seek immediate medical attention. After reporting your symptoms to your doctor, they may refer you to heart specialist or cardiologist. Your cardiologist will perform a physical exam, which will involve listening to your heart with a stethoscope to detect abnormal heart rhythm. To confirm an initial diagnosis, your cardiologist might order certain diagnostic tests to examine your heart valves, blood vessels, and chambers. There are a variety of tests used to diagnose heart condition because these tests measure different things. Your doctor may recommend a few to get a full picture of your current condition. You and your doctor may consider different treatments depending on your overall health and how far your condition has progressed. There are two ways to treat heart failure. First is congestive heart failure drugs, including ACE inhibitors or angiotensin converting enzyme inhibitors. Open up narrow blood vessel to improve blood flow. Beta blocker can reduce blood pressure and slow a rapid heart rhythm. Diuretics reduce your body's fluid content. CHF can cause your body to retain more fluid than it should. Second is surgeries. If medication aren't effective on their own, more invasive procedures may be required. Angioplasty, a procedure to open up blocked arteries, is one option. Your cardiologist may also consider heart valve repair surgery to help your valve open and close properly. Your condition may improve with medication or surgery. Your outlook depends on how advanced your CHF is and whether you have other health conditions to treat, like diabetes or high blood pressure. The earlier your condition is diagnosed, the better your outlook. Talk to your doctor for the best treatment to plan for you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.